Gender-based violence is a scourge in South Africa, with the numbers staggering year on year. A groundbreaking study was released today in Pretoria by the Human Sciences Research Council, looking into the prevalence of gender-based violence as well as its trends and patterns, many of it confirming what we have been reporting and seeing on the ground over the last few years. During 2020, during the lockdown, President Cyril Ramaphosa described gender-based violence and the violence against women and children as a second pandemic.
That 33.1% of women aged between the age of 18 and older have experienced physical violence in their lifetime. And that amounts to 7.3 million women in our country. Another stats, 9.8 have faced sexual violence in their lifetime. That translates to 2.1 million women in our country. And I want to echo what Dr. Zungu said, women in their diversity, so that we don't underscore which one in particular. She later then said we looked closely to women with disability, and that presented an additional statistic.
Emotional, economic and controlling behaviours were also prevalent, with younger and Black African women disproportionately affected.
The study, as you said, it's groundbreaking. The important thing about the study is that we went to women's homes and men's homes and interviewed them. So unlike the data that you're talking about that comes from the police, where the woman has to go to the police and deal with all the challenges and possibly even secondary traumatization. This study was designed to be very sensitive to the issues of gender-based violence and also encourage disclosure. And when we look at our results and compare it with, for an example, the South African Demographic Health Survey, we see that our figures are not too far from what they had found. We've also compared what we have with international surveys and work from the WHO, and we are seeing that we are within the range.
Whilst even for women with disabilities, the numbers are still very high, but what it means is that with that sector, which is about 3.3 million in South Africa, those that are women will experience sexual abuse more than the women without disabilities. They will experience a physical abuse more than, and you can imagine, like we were saying in our statement, that many of them will not even be able to report it because maybe they can't speak, they can't hear, probably they can't even walk, and therefore they are left in the houses with these perpetrators, because remember again, we are saying it will be family members, it will be somebody that is very close to this woman who will abuse them. So they will keep this within themselves, or they will not be able to express. And the court, if they were to go to court and report these cases, will expect them to be able to give evidence beyond reasonable doubt.
The study is calling for a comprehensive national action plan.
We need to start early in terms of when we intervene. We shouldn't be waiting for when people go to work or they are going to tertiary, but we should start very early with those couples in their teens and start working with them to make sure that gender-based violence is not how people respond within relationships. But it also points to this crisis of mental health. And you would have seen data around mental health that was emerging as one of the factors. So we do need, as a country, to review our mental health services and make sure that they reach not only the victims, but children who witness. As you saw, witnessing a parent, especially a mother, being violated by a partner was one of the risk factors.
I think it's a matter that requires all of us to look at it, and therefore for me it's the training of the people in the justice system, the whole of lot of them, but of course to encourage women to say let's go and report these cases, because if we don't, that perpetrator will continue to do it.
The report comes a week before 16 days of activism against gender-based violence campaigns. Hasina Gori, SABC News, Pretoria.